Good afternoon, everyone. We are joined by the Prime Minister and Ministers Freeland, Duclos, and Qualtrough, as well as Dr. Tam and Dr. New. We will begin with opening statements followed by a question and answer period. Please, one question, one follow-up per caller. Prime Minister.
Thank you very much. Good morning, everyone. We're joined virtually by Ministers Freeland, Qualtrough, Duclos, as well as Dr. Tam and Dr. New. We're here today to talk about what we're doing to support workers and businesses and keep people safe. Before I get started, I just spoke with the two new leaders of Chile and Germany, both progressive leaders, where we talked about climate change, growing the middle class, trade and youth, protecting democracy, and of course, how we're all going to work together to get through this COVID pandemic. À quelques jours de Noël.
A few days from Christmas, I know that many of you are concerned. Just like we have been since the beginning of the pandemic, we are here for you. And today we are adapting our measures to make sure that no one is left behind.
To have everyone's backs, as long as it took, as much as it took. That was the right thing, not just to help minimize the impact of the health crisis, but also to ensure that our economy could handle the shocks that this crisis is facing. And that's, unfortunately, what we're going to be continuing to do right now. I say unfortunately because, of course, nobody wants to be in the middle of an Omicron wave right now, but we are. So we are announcing today that we're temporarily expanding eligibility for key programs. For the Canada Worker Lockdown Benefit and the Local Lockdown Program, you'll be able to apply if you're subject to capacity limiting restrictions. The Deputy Prime Minister will have the details, but here's the bottom line. We need to, all of us, do what it takes so Canadians are protected and to have what you need to weather the storm. We're going to be there for the hard-hit regions, for specific sectors like art and culture, hospitality, and tourism. We will be there to keep you and your family safe. We're going to continue to work closely with the provinces and territories, but we will be there with supports for the areas that need it.
Our priority is for hospitals not to be overwhelmed. Over 80% of Canadians are fully vaccinated, so you have done the right thing and your efforts are helping. For those of you who are not yet vaccinated, please be vaccinated. And also know that we have enough booster shots for all eligible Canadians. So please make your appointment when it is your turn. We know that these booster shots will help.
We have enough in the country for everyone who needs it. So please go get those booster shots. They give you extra protection against Omicron and in keeping us all safe. Pediatric vaccines continue to roll out. Get our kids vaccinated as well. It's going to be really, really important that we do everything we can to get through this. We know that rapid tests are a part of the solution as well. We've delivered about 85 million rapid tests up until the month of December to provinces and territories. Just this month in December, we're delivering about 35 million rapid tests to provinces and territories, and we've got tens and tens of millions more rapid tests arriving in the coming weeks into the new year. So provinces and territories will have the supplies necessary to get them into people's hands. We need to follow public health guidelines to keep loved ones safe and to support our healthcare workers. I know people are tired. People don't want to be in this Omicron situation. I get it. None of us want to be here. We're tired of COVID. We want it to just go away. But we know it's not going to just go away unless we all do our part. Particularly when you think of how tired you are, how weary you are of having to deal with this COVID crisis that continues to go on and on and on. Know that there are people more tired than you. Know that our healthcare workers haven't had much of a break over the past 2 years, that they've been going flat out, keeping people safe, working in long-term care homes, working in hospitals and clinics, administering vaccines and boosters. Our frontline health workers have been extraordinary heroes. They have been there for us every step of the way. And now we need to be there for them. We need to prevent Omicron from overwhelming our healthcare systems. In order to do that, we have to keep contacts low. We have to make choices that are going to keep us and our families safe, because Omicron is out there. And the way we show our support for those people who've been keeping us safe is by making sure they don't get overloaded this winter. We know this variant is spreading very quickly around the world, around the country, and indeed around our own communities and offices. My office is not immune. We have 3 members of my staff and 3 members of my security detail who've tested positive. They're following all public health guidance. So am I, and so must we all. But it's a reminder that the virus is all around us. It's very much a threat. We have to keep our guard up. À Noël, je sais qu'il y a des gens.
At Christmas, I know that there are people who will not be able to gather as they wished to. I also had plans to spend time with my close loved ones, but there will not be any parties or gatherings, and this is a reality we all are facing.
We know what works. Canadians have shown over the past 2 years that we're able to step up for each other, that we are there for each other. We know what to do. We know how to wear masks. We know how to keep our distances. We know how to reduce our contact numbers. And if we do that well over the next couple of weeks, we're going to see a better winter and especially a better spring than otherwise. I know nobody wants to be in this situation right now, but Canadians have shown that we're there for our neighbors. We're there for our most vulnerable. We're there for our frontline health workers. We have vaccines. We have PPE. We have rapid tests. We know what to do. We're going to do it, because that's who we are as Canadians. We stick up for each other. We make those tough choices to keep each other safe. And we know that as long and dark as winters can be, spring is coming, and spring will be better if we hunker down in the coming weeks. Merci beaucoup, mes.
Thank you very much, dear friends. Now I will hand it over to Deputy Prime Minister Freeland.
Hey, merci, Monsieur le Premier Ministre.
Thank you, Prime Minister. Good day, everyone. In the past few days, we have observed an increase in cases of COVID-19. Certain regions of the country are reporting record numbers of cases. The Omicron variant of the virus is much more easily transmitted than the others. And we cannot be complacent. Since the beginning of the pandemic, we have endeavored to be flexible and to adapt to the changing nature of the pandemic. Within our programs, we are ensuring to plan for the necessary leeway so that we may react rapidly and effectively. Last week, we saw Bill C-2 adopted. This law made it possible to put in place targeted measures to support workers and companies if lockdowns became necessary to contain the spread of the virus. During the month of October, when we introduced these more targeted measures, we did not yet know the Omicron variant, but we made sure that we were ready.
Today, through regulatory authorities that were approved with the passage of Bill C-2, we are announcing our decision to temporarily expand the definition of a lockdown so that these wage and rent support programs can support workers and businesses that see capacity restricted by 50% or more. So, what exactly does this mean? It means that if you are an employer who has to reduce the capacity of your main business by 50% or more, you will be eligible for wage and rent subsidy support through the local lockdown program. And we are lowering the revenue decline threshold from 40% to 25%. Eligible employers will receive wage and rent subsidy support from between 25% to up to 75%, depending on how much revenue they have lost. Your organization only needs to demonstrate revenue loss during the current month compared with 2019. Employers will be able to apply for these expanded support programs after the end of each program period in exactly the same way that they received wage and rent subsidy support when those programs were launched last year. For workers, our decision means that if you are working in a region where the provincial or territorial government has introduced capacity restrictions of 50% or more, and if you have lost 50% or more of your income as a direct result of those restrictions, you can qualify for the Canada Worker Lockdown Benefit. This benefit will put $300 a week in your pocket to supplement your lost wages. This proposed expanded eligibility will be effective as of last Sunday, December 19th, 2021, and it will run through to February 12th, 2022. Many parts of the country have already introduced circuit breaker public health restrictions in order to curb the rise in cases of COVID. These expanded federal support measures will ensure that provinces and public health authorities across the country can continue to make the right, difficult decisions they need to make to save lives, confident in the knowledge that the federal government will be there to financially support workers and businesses as we finish this fight.
Our government knows that other companies are still being impacted by the pandemic. Since yesterday, eligible employers have been able to apply for financial aid through the Tourism and Hospitality Recovery Program and the Hardest Hit Business Recovery Program. These programs propose wage subsidies and rent assistance up to 75% and 50% respectively. In October, when we announced these programs, we estimated they would cost $7.4 billion. Last week, in the Economic and Fiscal Update, we set aside an amount of $4.5 billion in planning for the impact of the Omicron variant. The cost of expanding the support measures is estimated to be $4 billion and will be completely covered by the amount that we planned for in the update.
And finally, let me add that public companies receiving the wage subsidy through these support programs that increase their top executive compensation in 2022 compared to 2019 will have this wage subsidy support clawed back. These companies will also become ineligible if they pay dividends while receiving the wage subsidy. So, as Dr. Tam reminded us last week, all pandemics do end. The emergence and the swift rise of Omicron is not something that any of us welcome. It's coming at a hard time, at a time when many of us, particularly our remarkable healthcare workers, are really, really tired. But I know that we can and we must do what it takes to beat this virus, to finish the fight against COVID. Canadians are smart. We are resilient. we support each other, and we have the tools we need, both healthcare tools and financial support measures to win this fight against COVID. With today's expanded federal support programs, Canadians can follow new provincial health restrictions, knowing that the federal government is there, as we have been from the start, to support everyone. Thank you. And let me now pass the mic over to my colleague, Minister Carla Qualtrough. Carla, please.
Merci.
Thank you. Good day.
you.
I would like to briefly speak to you about how we are supporting Canadian workers in the face of this rapidly evolving pandemic. Recently, we noticed an increase in the number of people receiving a positive result here in Canada for COVID-19. Once again, we are seeing provinces and territories having to impose partial closures and restrictions. My own province of British Columbia made such announcements yesterday.
We've learned that COVID-19 is unpredictable, and we don't always know what lies ahead. But unfortunately, we know that we could be in a situation again where there would be new regional public health measures to help stop the spread of COVID-19. So when we introduced Bill C2, which included the Canada Worker Lockdown Benefit, we made sure we built in flexibilities so that we could be agile and make adjustments to support Canadian workers in their time of need. As we've been monitoring the public health situation, we've seen the need to expand the eligibility of the benefits for Canadians whose jobs are impacted by partial lockdowns or reduced capacity orders. That's why today we're making the necessary and temporary adjustments to the benefit to expand the definition of a lockdown order to include workers facing work reductions as a result of capacity restrictions of 50% or higher. Eligible workers could receive $300 per week if they've lost work as a direct result of a public health lockdown order. This Canada Workers Lockdown Benefit is in addition to the Canada Recovery Sickness Benefit and the Canada Recovery Caregivers Benefit, both which remained available to Canadian workers. We understand that Canadians may be feeling discouraged by the recent rise in COVID cases and new public health measures, especially at this time of year. And while the situation is evolving rapidly across the country, please be assured we'll continue to support Canadian workers as we've done throughout the pandemic. I'll leave it there and I'll pass it on to my colleague, Minister Duclos.
Merci beaucoup.
Thank you very much, Carla, and good day, everyone. I'm very pleased to be joining you virtually today.
For being here. Today, I want to provide you with a brief, quick update on the current COVID-19 situation. Even though we had all hoped that this holiday season would look very different than what it does, there are still many reasons to be optimistic. Vaccines for adults and children are widely available, as well as booster doses, thanks to the largest vaccination program in Canadian history. As we end this year, over 80% of eligible Canadians are indeed fully vaccinated. Du 19 Novembre,
Between November 19th, which was the date Health Canada authorized Pfizer's vaccine for children, and December 11th, 32% of children in Canada aged 5 to 11 have received one dose. This happened in just 3 weeks. These are remarkable accomplishments. We would be in a far more challenging situation if we did not have such high vaccination rates in Canada. So first of all, I would like to thank everyone who has already been vaccinated this year. Now that booster shots are available, I encourage everyone to make your third appointment if it has not been done already.
and then getting a booster, whether Pfizer or Moderna, will help provide protection against infection and illness. On this particular point, let me be very, very clear. As soon as you're eligible, whether it is Pfizer or Moderna, you should take the first booster dose available to you. If you have yet to be vaccinated, it is not too late. Every additional vaccinated person helps support our defense against COVID-19, as well as protecting personal health and safety. The Government of Canada continues to work closely with provinces and territories and public health partners to accelerate the rollout of booster vaccination campaigns. Close to 5 million Canadians have already received their booster doses.
We also have sufficient mRNA vaccines in stock to administer more than 20 million booster doses across the country. Millions of additional doses will arrive in the coming weeks and months. The supply of boosters is sufficient to offer everyone to have one who is eligible in Canada, whether it be Pfizer or Moderna boosters. Both are safe and effective. As soon as you are eligible, I encourage everyone to make an appointment for the first available booster.
With provinces and territories to increase access to rapid testing supplies across Canada. As you may be aware, each province and territory determines its desired approach for testing, screening, and surveillance, as they are responsible for the delivery and administration of healthcare services. We are making sure that our distribution strategy ensures equitable access to rapid tests for Canadians all across the country. As a screening tool, rapid testing provides another layer of protection against COVID-19, along with many other public health measures, such as mask wearing, hand hygiene, physical distancing, proper ventilation, and obviously vaccination. Rapid tests are able to identify individuals who have a high viral load, despite the test's lower sensitivity compared to a molecular PCR test. Des résultats rapides.
Quick results mean timely action. But it's important to remember these tests are not perfect. If you test negative, continue using caution with others, as you may still be in the early stages of infection and you might potentially infect others. If you test positive, it's critical that you self-isolate and follow local public health advice. Now, regarding delivery of rapid tests, the majority of the 35 million rapid tests requested by the provinces and territories for December have already been delivered. The remaining tests will be received before the end of the month, and tens of millions more will be delivered in January and February.
Also continuing to expand the distribution of rapid tests across Canada. In time for the holidays, we're further working with the Canadian Red Cross, who will partner with community organizations, including food banks, to distribute rapid tests to Canadians who use their services. In conclusion, I will urge you to continue to be prudent and responsible this holiday season. Please take responsibility for your health and the health of others by following the advice of local public health officials.
Stay safe and stay vigilant. Please get vaccinated if not already done. And if you are eligible, please get your booster dose. The outcomes across the country in the weeks and months to come will be determined by the decisions that we make and our actions during the holidays. I will now turn the microphone over to Dr. Tam and Dr. New.
Bonjour.
Good day, everyone.
So in less than a week, we've seen a rapid acceleration of epidemic activity in locations across Canada. While Delta is still spreading in many areas, Omicron is increasingly responsible for rapid rise in case counts. With over 2,360 confirmed Omicron cases to date, this new variant is now predominating in several locations across Canada. Compared to a national average of over 5,000 new cases being reported daily by the end of last week, there were over 11,300 new cases yesterday alone. Modeling shows that by the beginning of January, we could have very high number of cases, which underscore the need to act urgently now to reduce the acceleration. At the moment, severe illness trends are increasing in the most heavily impacted provinces, which has begun to shift the national trend. Over the past week, on average, over 1,500 people with COVID-19 were being treated in our hospitals each day, with close to 460 in intensive care units and 17 deaths were reported daily. Although the current trends may be a lagging impact of increased Delta activity in the preceding weeks, rapid acceleration of Omicron activity is expected to further impact these trends as well, even if Omicron turns out to be less severe. Because we're especially worried about the potential impact of a sudden and strong surge on the healthcare system, we're urging all Canadians to do what they can to help mitigate this. Although the situation is not the same everywhere, this variant spreads extremely quickly, and the situation can rapidly get out of hand anywhere. So while public health authorities are closely monitoring the evolving situation, we can all help by reducing our contacts as much as possible. Practically speaking, this means keeping gathering sizes as small as possible, such as limiting to just family and close friends who you know well. Everyone who's eligible should get fully vaccinated and receive a booster dose as soon as they are able. And everyone should use layers of protection, since no measure is perfect or applicable for all people. In particular, we can reduce the risks of exposure and spreading the virus by improving and maintaining good ventilation and wearing a good quality and snug-fitting face mask, while remaining flexible if plans need to be adjusted at the last minute. Currently, we'll still need many more people to increase their protection with COVID-19 vaccines. Over 7 million eligible Canadians need a first or second dose of the primary series, and many more are eligible to get a booster dose to help restore protection that may have waned since their second dose. Booster doses of either Pfizer or Moderna mRNA vaccine should be prioritized for certain groups, such as healthcare workers and those at highest risk of severe illness from COVID-19, including older adults and people with high-risk medical conditions. Although we're all dealing with some disappointment and changed or disrupted plans, I hope we can all agree that we're doing what we need to do for all the right reasons. Beyond taking extra precautions to safeguard our health and the health of our family and friends, we're also adjusting to safer plans in order to safeguard our health system and get everyone through this difficult time that much faster. We've said this before, but I want to especially acknowledge our healthcare and public health workforce. They have been there for us and have made daily sacrifices that many of us can only begin to imagine. Now that they are facing what could be the largest and most sudden impact to date, at any time when they are arguably at their most exhausted, they need to know that we're all doing everything we can to minimize the threat before us all. These are not the holidays we wish for, but it doesn't mean that we're back where we started. We have more and better tools in our toolbox, including vaccines and booster doses, better knowledge of transmission and enhanced guidance on individual protections, as well as more testing options and improved clinical management and treatments. For the coming weeks, we have to work to these strengths and keep working together to clear this hurdle. Thank you. Merci, Megwitch.
Bonjour à toutes et à tous.
Good day, everyone. In less than a week, we've seen a rapid acceleration of epidemic activity in many locations across Canada. While Delta is still spreading in many areas, Omicron is increasingly responsible for rapidly rising case counts. With over 2,360 confirmed Omicron cases to date, this variant is now predominating in several locations across Canada. Compared to a national average of over 5,000 new cases being reported daily by the end of last week, there were over 11,300 new cases yesterday alone. Modeling shows that by January 1st, we could see a daily average of as many as, or rather, at the current time, the trends of severe illness are increasing in hardest hit areas, which is shifting the national trend. In the past week, on average, over 1,500 people with COVID-19 were being treated in our hospitals each day, and 17 deaths were reported daily. Although the current trends may be a lagging impact of increased Delta activity in the preceding weeks, rapid acceleration of Omicron activity is also expected to further impact these trends, even if Omicron turns out to be less severe. We are especially worried about the potential impact of a sudden and strong surge on the healthcare system. So we are urging all Canadians to do what they can to help mitigate this. Although the situation is not the same everywhere, this variant spreads extremely quickly, and the situation can rapidly get out of hand anywhere. While public health authorities are closely monitoring the evolving situation, we can all help by reducing our contacts as much as possible. Practically speaking, this means keeping gathering sizes as small as possible, for example, by limiting to just family and close friends who we know well. Everyone who is eligible should get fully vaccinated and receive a booster dose as soon as they are able. And everyone should use layers of protection, since no measure is perfect or applicable for all people. In particular, we can reduce the risks of exposure and spreading the virus by improving and maintaining good ventilation and wearing a good quality and snug-fitting face mask while remaining flexible if plans need to be adjusted at the last minute. Currently, we still need many more people to increase their protection with COVID-19 vaccines. Over 7 million eligible Canadians need a first or second dose of their primary series, and many more are eligible to get a booster dose to help restore protection that may have waned since their second dose. Booster doses of either Pfizer or Moderna mRNA vaccines should be prioritized for certain groups, such as healthcare workers and those at highest risk of severe illness from COVID-19, including older adults and people with high-risk medical conditions. Although we're all dealing with some disappointment and changed or disrupted plans, I hope we can all agree that we're doing what we need to do for the right reasons. Beyond taking extra precautions to safeguard our health and the health of our family and friends, we're also adjusting to safer plans in order to safeguard our health system and get everyone through this difficult time that much faster. We have already mentioned this, but I want to especially acknowledge our healthcare and public health workforce. They have been there for us and have made daily sacrifices that many of us would have a hard time imagining. Now that they are facing what could be the largest and most sudden impact to date, and at a time when they are arguably at their most exhausted, they need to know that we are doing everything we can to minimize the threat facing us all. These are not the holidays we wished for, but it doesn't mean that we're back where we started. We have more and better tools in the toolbox, including vaccines and booster doses. We have better knowledge of transmission and enhanced guidance on individual protections, as well as more testing options and improved clinical management and treatments. For the coming weeks, we have to work to these strengths and keep working together to clear this hurdle. Thank you.
Thank you, Miigwech.
Thank you. We'll now move to questions. Just a reminder, one question, one follow-up, and heads up that the Prime Minister can take questions for 20 minutes. The other ministers and the doctors will stay after that. Thank you. So, operator.
Thank you. Merci. For questions, please press *1 on the device's keypad. Pour toute question, faites étoile 1 sur votre appareil. The first question is from Mike Lecouteur from Global News. Please go ahead. Your line is open.
Thank you for taking our questions. Prime Minister, if you forgive me and permit me a bit of a double-barreled question, since you gave us a bit of news, seeing that you said some of your staffers and member of your protective detail have tested positive. So on the first side, I wanted to know, have you taken a PCR test or rapid test to check your status and share that with us? But also, many Canadians are having these difficult conversations with their family ahead of Christmas. So what was the conversation like in your household with your kids and family, seeing as how you likely had to change how your holiday plans will play out?
Thanks, Mike. First of all, we are following all public health guidelines every step of the way. The members of my staff and detail who have tested positive are following public health guidelines, as am I, as are everyone. I have been taking rapid tests, so far negative, but following public health guidelines, I'm being careful about everything that I do, which is part of the reason why we're in virtual today. Secondly, a lot of people are having very difficult conversations. Nobody wanted to be in here right now in this situation. We were looking forward, now that 80% double vaccinated in Canada, we were looking forward to a bit of a respite, a time to gather as families and friends at the holidays and celebrate what looked like perhaps the beginning of the end of COVID. And then Omicron came and changed that for everyone. And nobody wants to be in this situation. But we know what to do, Mike. And yes, there have been lots of conversations about not seeing friends, not gathering for New Year's, not gathering outside of immediate family for Christmas in our household, like in a lot of households. But quite frankly, there's a lot of people for whom those conversations around having more restricted holiday gatherings are still better news than what a lot of Canadians are facing. People who will be totally alone for Christmas, people who are facing significant health challenges, people who are dealing with mental health issues that have been exacerbated by the past 2 years of extraordinary difficulty. Most of us will just have a slightly smaller number of gatherings and contacts through these holidays, which we'll survive through, won't be all that great. But let us think of those people who are working in our hospital rooms, in our critical care facilities, out there giving vaccinations and boosters, and continuing to do everything they can to keep us safe, for whom this holiday will be more difficult and, quite frankly, will determine just how difficult the entire winter will be.
And just as a follow-up, when you talk about the announcement of the expansion of the benefits, things have been moving very quickly, probably more quickly than we have at any point during this pandemic, but it's also not our first wave. How is it that some feel that we're still behind the eight ball here, we're playing catch-up with Canadians not being able to access the programs they need in the timely fashion they need, because a lot of people feel like they saw this coming, but the benefits weren't there yet?
We saw this coming. We saw the potential for this coming, which is why we put forward Bill C2, Bill C3 measures to support people. We are glad it got passed at the very end of the parliamentary sitting. We would have liked it to have been passed earlier, but having been passed now, we're able to adjust the regulations a little bit so as where it was created in case of localized lockdowns, that there be supports. Now we're expanding it so that it's there for places with reduced capacity. So we have the measures in place. Sure, we would have liked to have been able to pass them quicker in this parliament, but as you know, Mike, parliament moves at its own speed, but at least they are in place now so we can be delivering those supports to Canadians as quickly as possible.
Thank you. Merci. La prochaine question nous vient de Boris Proux.
Next question from Boris Proux from Le Devoir. Over to you. Good day. A very simple question. On the expansion to business aid measures, does it apply to businesses that were created during the pandemic? Answer. Very good question. I will hand it over to the Deputy Prime Minister. Thank you, Prime Minister. The answer is no. We are using the same platform and the same rules as we used for the wage subsidies and the rent assistance. So these are programs for businesses that were there before the beginning of the pandemic, businesses that were created when no one knew that we would be experiencing this fight against a pandemic. Thank you. As a follow-up question, what has been planned for those people whom we've asked to renew or to dive back into business? What do you say to those people who are still not eligible for these new aid programs? Answer. First of all, I would say that, as the Prime Minister just explained, the important thing to note is that Canada is ready, that even in October, when no one knew what Omicron was, we understood that it was necessary to have an insurance policy. We understood that the fight against COVID was not yet finished and that it was necessary to have tools to respond very rapidly to a new wave of the pandemic. And that is what we did, as we saw in October. And these are new measures that we are announcing today. It was always true that, yes, we are there for businesses, we are there for Canadians, we are there to support the economy, but we must have an approach that has integrity. We must approach the situation being able to compare data, and we find that the fairest approach is one that uses a comparison between current revenues with revenues before the pandemic.
Merci. Next question is from Mackenzie Gray from CTV News. Please go ahead. Your line is open.
Hello, Prime Minister. In Ontario and a number of other provinces right now, the testing system has essentially collapsed. There's multi-day waits to get a PCR test. People are lining up at 5 o'clock in the morning even to get a chance to get a rapid test. And for boosters right now, it's basically Hunger Games to try and get a shot. We're 2 years into the pandemic, basically. So how is Canada in such a terrible position right now?
Well, first of all, Mackenzie, on rapid tests, as of the beginning of December, we'd sent out 85 million rapid tests to provinces and territories. That's over the past year. Not all of them had been used. And there were many stockpiled. We're delivering more rapid tests now, 35 million throughout this month, with tens of millions more. There are provinces and territories, I think of particularly Nova Scotia, that has been doing an exemplary job of using rapid testing in communities, in commercial businesses, sharing them with Nova Scotians in a way that has allowed for a regular monitoring of people's conditions. Other provinces are now starting to do that, which is a good thing. The federal government, as we promised to, is procuring millions upon millions, over 100 million rapid tests and sending them to the provinces. All told, we will be doing more to make sure that rapid tests are getting out there for people. It is a matter of provincial and territorial distribution to get those rapid tests into people's hands so that they can use them. In regards to boosters, when we signed our vaccine agreements, we updated them with advanced purchase agreements for vaccine doses, tens of millions of vaccine doses into 2022, into 2023, and indeed beyond. That's why we are in such good situation right now in terms of boosters. We have enough boosters in Canada for everyone who is eligible to go get themselves boosted, to get themselves fully vaccinated. Obviously, there are pressures on distribution, on getting those into arms as quickly as possible, and provinces are in charge of that, but we will, of course, look to be helpful in any way. But in terms of booster supply, the federal government is there.
Just in terms of the potential COVID situation that you might yourself be in, just a little bit more.
Rapid tests that I do testing regularly. So far, it's all been negative. You will know if ever it becomes positive. I promise you that. And also to try and reduce my contacts as much as possible. But it is not the recommendation from public health at this time, given the nature of the contacts with my staff, that I go into full isolation. But of course, we're going to continue to monitor and follow those public health guidelines to the letter.
Thank you. Merci. La prochaine question, Julie-Anne Lapointe.
Next question from Julie-Anne Lapointe from Radio-Canada. Over to you. Good day, Mr. Trudeau. Why not completely close the borders? Is that still an option on the table? Answer. We are always open to any option that can better ensure Canada's safety. We have already established that. The current reality is that Omicron is already present in our communities throughout the country. Therefore, shutting down the borders at this point would not be an effective measure. As we saw during past waves, arrivals at the border represent an extremely small percentage of COVID cases. So what we want to focus on and send our resources to is decreasing gathering sizes in communities over Christmas. But as I've said, we will continue to follow science and look to public health experts. But closing the borders at this point in time would not be beneficial, because we also must remember that a permanent resident or a Canadian citizen has the right to return home at any time. We cannot close the border to Canadians. They always are allowed to come home. So we are focusing more on communities. Now I can also hand it over to the Minister of Health. Yes, thank you, Prime Minister. I would also add that in Canada, and this has been true since the beginning of the pandemic, we have, compared to other countries, some of the strongest border measures of any country. I would like to stress an important layer of protection, which is testing before coming into the country, which is required. And that was a layer of protection that we quickly implemented. And we also put in place another measure, which is testing upon arrival. So we are using a multi-layered approach. And I also support what the Prime Minister said, that is that community spread now even more than for prior variants, including Delta, is what we're focusing on, and that is in part because of the very transmissible nature of the Omicron variant. That is why we are focusing on short-term contacts. Follow-up question, still for Mr. Trudeau. You had to change your holiday plans. It's like Groundhog Day, except this time we're vaccinated. It doesn't seem like there's a miracle solution. What would you say to Canadians who are feeling discouraged when they look to the coming months? You might be on mute.
Excusez-moi.
I'm sorry about that. Let me try again. I understand how exhausted and sick of COVID people must feel. I know that no one wanted to end up in this situation. But I would like for people to keep in mind that our healthcare workers are even more exhausted by the pandemic. For them, they have been working extremely hard for 2 years since the beginning of the pandemic. And I know it is difficult for all families, not just my own, to decrease gathering sizes and to only see very close family members. But we need to be careful during this holiday season. We must continue to do the right thing, to do things right, and to do what we know how to do. We know how to reduce our contacts. We must continue to be vaccinated, to get our booster doses, to wear our mask, hand hygiene, etc. These are all things that we have known how to do and will help us get through this.
Thank you. Merci. The next question is from Jordan Press from the Canadian Press. Please go ahead. Your line is open.
Good afternoon. Prime Minister, just a moment ago you said that we were prepared for the potential for this to happen when you talked about the benefits. And yet it seems that in many parts of the country, despite warnings that Omicron was coming, it seems that there's been, from what many people would believe, is a failure of the system. When you think of, for instance, testing capacity, as one of my colleagues asked about. So I'm wondering, given your comments, if you believe that it is really the provincial and territorial governments that have dropped the ball on this. And if not, how much responsibility does the federal government then shoulder for the failure that we are seeing now of the system that seems to have been unprepared for Omicron despite the warnings?
No, that's a very good question, Jordan. The reality is we have all been working flat out and learning much about COVID over the past 2 years, and indeed bracing for Omicron. When Omicron started to hit, we took immediate measures at the border to try and slow the arrival of Omicron, which I think probably bought us a little bit of time. But even before Omicron's arrival, we were there on stepping up to order enough boosters into 2022 for all Canadians, which is why people can be comfortable going to get that booster shot that does provide protection against Omicron as quickly as possible so that we can stay safe. We have continued to order rapid tests. We ramped up our ordering of rapid tests actually in the fall of 2020. And over the past year, we have delivered close to 100 million rapid tests to the provinces. We're continuing to order even more. There will be more. Questions around distribution, questions around speed and ease of access are more properly given to the provinces, but we will be there to support. Like I've said, the example of Nova Scotia as a place that has adopted early and rapid use of rapid testing. It was just something that they were ready for, and therefore have seen positive results from. But Omicron is here, and we're just going to have to hunker down and be careful. The measures that we put in place to support businesses, like I said, we saw that as a need for local lockdown potential through the winter. But because we put those measures in place, we are able to adjust them so that they are broader based and able to affect more people given the scale of this Omicron wave.
And as my follow-up, I'd like to ask you about President Biden's speech yesterday, because he obviously, the messages that American presidents deliver have long been heard in Canadian living rooms and homes, despite the fact they don't govern Canadians. And yet I'm wondering what you make of what he said, of what President Biden said yesterday as far as the holiday season, and how much do you think that will resonate with Canadians and some of the decisions that they may make, given the message you're delivering today? Canadians are among the most vaccinated people in the world.
Americans have a much lower double vaccination rate, which is certainly something that the president no doubt had on his mind as he was, touting the benefits of being vaccinated. But we know, and I'll turn to Dr. Tam right after this, we know that Omicron can break through double vaccination, which is why it is so important to get that third booster shot. It spreads much more quickly, it is more contagious, but vaccination will prevent people to a large extent from getting into the ICU, from getting the severe outcomes. So vaccination is still a really, really important part of our pillars of defense against COVID, against Omicron, but it's not the only thing. What we need to do on top of being so well vaccinated as we are is get those booster shots and make efforts to reduce our contacts during the holiday season, reduce the spread of Omicron so we prevent our healthcare systems from getting overwhelmed. Even if, as it's starting to show, perhaps a lower percentage of people who get Omicron get into critical care, if the numbers skyrocket, that'll still be enough to overwhelm those healthcare workers who've been working so hard. So we need to know that getting vaccinated, getting your boosters, and being safe in the choices we make as we gather is how we get through this. The good news is Canadians have done it before. We've done it through the difficult waves. We know what to do. We know it gets better afterwards. We're just going to have to hunker down for the coming weeks as it'll prove to be a difficult winter. But I'll turn to Teresa right now to add or complete anything that I just said.
Well, that was a very comprehensive answer from the Prime Minister. I think we need to focus on how to manage this particular wave and this variant by focusing on reducing impacts on the health system and reducing the severe outcomes. I know that it is very difficult with a very rapidly escalating transmission going on with Omicron, that we can't prevent every case. We can't actually detect every case necessarily because of the sheer numbers from the provinces and territories. So the key thing is please focus on preventing any further impacts on the highest risk, the long-term care, the hospitals, making sure our healthcare workers are protected and any high-risk populations, and line up in a orderly manner, if you like, to get the boosters, because we want the highest risk to get protected first. That is the prime objective, and that can be done very easily. The doses are there. I think one particular point I want to make is that it's not just about numbers of vaccines or tests. We have a finite human health resource capacity. And so this is why we're doing what we're all doing now, so that people can get their boosters in a very organized manner, as well as making sure the tests are there for the high-risk populations.
So I'm told we are over time with the Prime Minister, but maybe we have time for one more, if that's okay, operator, for the PM.
Thank you. La prochaine question.
Next question from Olivier Ferrand-Boisé. Over to you. Good day. Thank you, Mr. Trudeau, for taking another question. I'd like to talk to you about Quebec's request for help from the Canadian Armed Forces. What types of resources do the forces have, and how many, in terms of numbers, could be deployed? And not only from the forces, but from other federal resources. Is there any other agency or body in the federal, at the federal level that could provide help? Answer, thank you for the question. As I said, as we have been from the beginning, we will continue to be there for provinces facing difficult situations, whether it be through the Canadian Red Cross, the Canadian Armed Forces. We will be there as much as possible, helping our provinces in difficulty. What is different now from previous waves is that Omicron is hitting everywhere all at once. So we will need to make choices to best be of assistance. We are in communication with Quebec and other provinces. We are looking at how we can best help and have the most impact, knowing that our resources across the country are limited. Jean-Yves is looking at this closely as well. Minister Duclos. Yes, it is true that Canadian resources are limited. We have been in communication with northern and remote communities. As the Prime Minister said, all provinces in this wave are in more or less a similar situation at the same time, and all need help. We are open and we are working with all jurisdictions. For example, yesterday I spoke to a premier so that I could know the specific needs of the particular region so that we can respond rapidly and effectively in cooperation with the other regions.
Merci.
Thank you. As a follow-up, could you give an approximate number of help that will be rolled out, for example, from the armed forces? Is it realistic to think that we will be able to reduce hospitalization rates in Quebec as well through the various approaches? Answer. I have recently received a briefing, and I can tell you that Health Canada is working extremely hard to carry out an assessment in order to approve helpful measures, and I will be pleased to hand it over to Minister Duclos, the Minister of Health. Minister Duclos, Health Canada is working in cooperation with departments from other countries who are doing exactly the same. As it relates to the pills from Merck and Pfizer, which would be administered 2 doses per day over 5 days. These are still being assessed.
Okay, thank you to the Prime Minister. We'll stay with the other ministers and the doctors for another 20 minutes. Thank you very much. Operator.
Thank you. Merci. The next question will be from Marika Walsh from the Globe and Mail. Please go ahead. Your line is open.
Good afternoon. I wanted to revisit the question that Jordan Press first asked the Prime Minister. The message from the U.S. Administration to Americans, where they have a lower vaccination level, much lower, is don't panic and enjoy the holidays if you're fully vaccinated. And I'm wondering what you expect Canadians to make of the fact that your message almost seems to be borderline to be at least very worried, if not panic. You're telling people to reduce contacts to immediate family and friends only. You're urging people to cancel their holiday plans. I'm wondering how you explain that difference to Canadians who consume so much U.S. news.
I will take a stab at that question to begin with, and then perhaps Jean-Yves will want to elaborate. Look, Canada is not the United States. And I think all of us know that very profoundly. And our countries have taken very different approaches in the fight against COVID. I know that this is a really hard time for everyone in Canada, but I think also we should take some comfort and draw confidence from the fact that when you compare how Canada has done to the way that other similar peer countries have handled the fight against COVID, Canada has done pretty well. We have the second lowest mortality rate in the G7. That's really meaningful. We, by sticking together, by supporting each other, by being resilient, we have managed to save a lot of lives. And we've kept our economy really intact as well. Now, the one thing I do want to sort of strongly push back against is this notion that the federal government, and I would also say the provincial governments too, that any of us are in any way offering a counsel of panic or a counsel of despair. That is totally not the case. Quite the contrary. I think Canadians should be reassured by the fact that we are ready for this as a country. We have the economic support measures in place. And actually, we thought about it beforehand. And already in October, we put in place laws with flexibility that are allowing us to respond really quickly to this situation. We have been ordering boosters, rapid tests, and therapeutics for precisely this situation. In the fall economic update, we provisioned the money to pay for all of these supports. And as Jean-Yves has been quite rightly emphasizing, as a country, we've done really well, not just on buying vaccines, but on all of us getting vaccinated. And as you see from the experience of many countries, that is not so easy to do. So I think as Canadians, we should really feel reassured by our demonstrated national capacity to handle COVID, by our demonstrated national resilience, by the fact that we have the tools, both economic and the health tools, to handle this, by the fact that provinces and territories and the federal government are working very closely together on this. I know Jean-Yves is in constant touch with his provincial and territorial colleagues. I am working closely with finance ministers across the country. So, you know, the message that we want to share with Canadians is, yeah, this is really, really hard. And it's coming at a time when we're all tired and when we were looking forward to really kicking back and relaxing. But we have done really well as a country so far. We are resilient. We're a careful country, and I think that's a really good thing. And I think all of us need to be careful. I think we all know that. And I'm confident that we will be. And I am really confident that we're resilient and we'll get through this. And I think that is the message from the Government of Canada, from all levels of Canadian government leaders to Canadians. And I have to say, you know, in my own neighborhood, that's exactly how I see people behaving, responsibly, carefully, in a really intelligent way, thoughtful about their own health, the health of their friends and family and their community. Jean-Yves, peut-être tu veux ajouter.
Jean-Yves, perhaps you would like to add something?
Been relatively successful. It's never perfect in any particular country, but if we compare ourselves to many other countries, as Minister Freeland said, we have been very successful on all sorts of fronts, including, as she mentioned, our ability to protect the health and safety of Canadians. She mentioned that we have had a lower death rate than other countries. In the United States, their death rate is 3 times of what we have seen in Canada. That means that had we had the same death rate as we have seen in the United States, we would have had 60,000 more people dying of COVID-19 in Canada.
Thanks for that answer. I just want to follow up on that because it seems the message from the U.S., just to challenge the Deputy Prime Minister, is not to panic and to enjoy your holidays. The message from Canada is clearly not that. And at the same time, the message from the U.S. is they are doing everything possible to avoid lockdowns, whereas your message today is on how the government is preparing for lockdowns and restrictions. And going to the government's responsibilities federally, I understand that provincially it's where the healthcare rollout is possible, but as the government watched the provinces sit on rapid tests for the last almost 2 years, why didn't the federal government take initiative and, for example, ship out tests directly to Canadians through the CRA or Post Canada or Elections Canada?
So, Marika, let me take on that question. And again, I'm just going to start by saying Canada is not the United States. I think we are all very, very aware of that. I think we are aware of and proud of the sovereign choices our country makes. And our country makes very different choices from the US, from many other countries on a lot of different issues. I do really want to emphasize, because you've used the word panic, I want to emphasize to Canadians that is in no way the attitude our government is taking. In the many conversations I have with provinces and territories and municipalities, that is in no way their attitude either. But we are taking an approach which is careful, which is prudent, which is focused on following the science, which is focused on saving lives. From the economic perspective, as finance minister, let me tell you that we have understood from the beginning of this pandemic that the strongest economic policy was a strong healthcare policy, and we are continuing to take that approach. We very much understand and respect the responsibility that provinces and territories have for healthcare and for making decisions about public health, and also at the decisions that public health officers make at even more local levels. They are there, they are on the ground. We do, however, at the federal level, know how hard it is to make those decisions, how hard it is for provinces and territories and municipalities to choose to restrict what businesses can do, what people can do. And so our support measures announced today are there to help public health officials at the provincial level, at municipal levels, to make the right decision to preserve the health of Canadians. And I'm very glad that we have put in place for ourselves the legislative tools to offer that support, that we have the balance sheet to offer that support, that we have thoughtfully and carefully provisioned in the fall economic update to offer that support. That is the Canadian way. We believe in resilience. We believe in supporting each other. And that's what we've done since the beginning of COVID. That's going to be what we continue to do. Jean-Yves, est-ce que tu veux ajouter?
Jean-Yves, would you like to add anything?
No, I think you said it really well, Krista.
Thank you. Merci. The next question is from Rafi Boudjikanian from CBC News. Please go ahead. Your line is open.
Thank you. This is for the health minister. We're seeing the province of Nova Scotia pretty much abandon using the federal COVID app, saying the uptake was very low, so they're relying on people who test positive to contact their own close contacts. In the whole country, we've seen more than 1.9 million infections. You've only got about 37,000 uses of the app. What would you say now to Canadians who are wondering what is the best way to contact trace for COVID, and what improvements would you seek to make to the app, if any?
Well, thank you for the question. I would point out first that all of these tools are complementary. They are never identical. They work in different manners, and all of them end up very useful as a set of tools. So the app is not obviously the only way by which people can both monitor and follow up on their contacts. That's obviously a key thing to do right now, given the large size of transmissibility of the new variant. the variant being very transmissible, the importance of following up on contacts, either through the app or through other measures, is extremely is paramount. So it's all about reducing contacts, protecting ourselves when we do have contacts, and if we get infected, making sure we share that information with others using the app or other tools. Now, this being said, as we also alluded to earlier, there are challenges in provinces and territories doing all of that work in a manner in the size with which Omicron is spreading across Canada, and the federal government is there to help and is going to continue to be there to help through procuring and distributing tools and resources such as the app and personal protective equipment and tests, rapid tests included, vaccines, boosters, and all sorts of other things, understanding again that this is complementary to other tools that provinces and territories will also want to use.
Thanks. And my follow-up question is to Minister Freeland. You announced the one-time payment for seniors who've had their guaranteed income supplements clawed back because they took pandemic supports. Critics are worried this money won't show up until May, that the uncertainty around when the payments will come is not only causing anxiety for seniors, but it's also resulting in some of them making some pretty hard choices, living in their cars or choosing to buy food over needed medication. Can you clarify when the one-time payments will start rolling out for seniors?
Thank you for the question. I am very conscious and very concerned about the difficulties that seniors who are eligible for the GIS but also got support from the CERB are facing. And it is precisely because our government shares the concerns that many people have and has been listening to those seniors that I made the announcement last week in the economic update that we would be making payments to those seniors to compensate them for that GIS which they lost. It is technically something quite challenging to do, just given the different payment systems the federal government has. I would like to assure seniors, though, that we're aware of their needs. Seniors who qualify for the GIS are among the most vulnerable people in Canada. And we are working really, really hard to get this done as soon as possible.
Thank you. La prochaine question est de Mylène Crête, La Presse.
Next question from La Presse. Line open. Thank you. Good day. Regarding assistance from the Canadian Armed Forces, I was wondering, just this week, how many provinces officially requested that assistance? And does the Canadian Army really have enough capacity to assist in vaccination? Answer. Thank you very much for the question. Now, regarding provinces and territories, my team and myself, and also Minister Blair, of course, and Minister Anand, are all in communication with the provinces and territories. I mentioned my conversation with Mr. Dubé yesterday. We are listening to what the provinces and territories want to share with us. The Canadian Armed Forces have limited resources. And many of the Army resources are already being used, have already been deployed in Indigenous and remote communities. But even if that were not the case, the magnitude of our country and the magnitude of the demands means that we are not necessarily able to use the Canadian Armed Forces medical resources as much as is being asked. That is why We are working with the Canadian Red Cross also. Which will also be helping Quebec, other provinces and territories. With Minister Dubé, we discussed this, and I know that my colleague Minister Blair has also had similar conversations to see what the best approach is to tackle the complex vaccination situation, including in Quebec. So non-medical related resources can also be deployed for the provinces. Follow-up question. My second question is for federal public health. What explains the difference in the number of cases in Quebec, which is a very high number, and Ontario, which has a higher population, but where the number of cases is lower than in Quebec? Dr. New? Oh, okay, it's for me. Thank you for the question. I thought Mr. Duclos wanted to start. So what we're seeing currently across the country is that we have community spread everywhere. In provinces, territories, including in Quebec and Ontario, regions are reaching their testing limit. So we know that the number of officially reported cases is certainly, or nearly certainly, an underestimation of the actual situation. So we will continue to gather data on case numbers in Quebec and Ontario, but we believe that the virus is everywhere in both provinces and others, but we do not know the exact numbers. As I said, it's underestimated in those provinces and everywhere in Canada. Another thing I think is important now is that we're beginning conversations with provinces and territories to ascertain what really is happening in hospitals, because our focus is on healthcare systems. For example, we don't yet know how serious consequences are for contaminated individuals with the Omicron variant, so we are in close contact with provinces and territories discussing that. We are looking at reported cases in communities, and we are also looking at the situations in hospitals. Thank you.
For one more question, please, operator.
Yes, merci. Thank you. The next question will be from Stephanie Levitz from the Toronto Star. Please go ahead. Your line is open.
Thank you. My question is for Minister Freeland. It relates to the expansion of the benefits. As we've all alluded to over the course of this press conference, the testing system in this country has more or less collapsed. And in many places, people are being told that they need to stay home and isolate for 10 days, as does their entire household if anybody has symptoms, because there's no capacity for PCR testing. So this is effectively a lockdown. But the Canada Worker Benefit, of course, even with your expansion today, only applies in like this very specific capacity restrictive instance. So I'm wondering for all of these people who are being told, please isolate, please limit your contacts, they can't go to work, they can't get a paycheck. So what is the government going to do for them? Are you looking at all at expanding this benefit program any further?
Thanks for the question, Stephanie. And let me just remind you, as Carla pointed out in her remarks, that the caregiver and the sickness benefit remain in place. We extended the number of weeks you can claim for those benefits. Each of those benefits is at $500 a week. And that was also part of Bill C2. And I'll also point to the fact that we have passed 10 days of federal sick leave. So for people specifically who need to stay home to take care of someone who is sick or needs to self-isolate, or who themselves are sick or need to self-isolate, those benefits at $500 a week continue to be in place as they were in sort of the darkest early days of the pandemic. And then I would sort of more broadly say, we recognize that the restrictions that many provinces and territories have put in place are very significant. And that is really at the heart of today's announcement. We use the regulatory flexibility that we built in to C2 to give us the ability to provide wage subsidy, rent subsidy, and income support to people even absent a full formal lockdown. That's the heart of what we're saying today. But I will maybe pass it over to Carla to see if she wants to say anything more, perhaps about the sickness and caregiver benefits.
Oh, well, thank you, Christia. Yeah, just to emphasize, Stephanie, how important it is to have the caregiver and sickness benefits available to Canadian workers. So the caregiver benefit is available for 44 weeks now, and the sickness benefit for 8. If your child is not able to go to school for reasons related to COVID, you can take time off work and get this benefit at $500. If you have to self-isolate, if you're sent home from work to self-isolate, you have access to the sickness benefit. So the lockdown benefit is additional to these two kind of foundational pieces related to public health and sickness and COVID itself. The lockdown benefit is for people who have experienced job loss or reduced hours as a result of public health lockdown orders, which come in a variety of shapes and sizes, as we've seen, including reduced capacity orders, which we're adding to the list of orders today or that are being added that qualify people for the lockdown benefit. So it's in addition to these other ongoing benefits that we have.
Okay, thank you for that. And just as my follow-up, I guess it's back to you, Minister Freeland. You earlier used, you were talking about the distinction between Canada and the U.S., and you said that we have demonstrated national capacity to deal with this. But have we, though? Because if we had the capacity to deal with this, then we wouldn't have PCR testing backlogs, meaning people have to isolate for days on end. We wouldn't be slashing business capacities to avoid overrunning our hospitals. And we wouldn't be worried about overrunning our hospitals if we had demonstrated national capacity. So I'm wondering, why does you think we are somehow better prepared or have the capacity in place to weather this when many people don't feel like that's their lived reality right now?
Well, look, it's a really good question, Stephanie, and I do not want in any way to minimize how hard things are right now, nor to minimize the fact that we are in for some even tougher times ahead. And that is true. And that is really hard. And I was going to say it's frustrating, but that is probably too mild an adjective. These are some very difficult times, and there are almost certainly even more difficult times ahead. But I do think that it is also really, really important for Canadians to be reassured by the progress that we have made in the 21 months we've been fighting COVID, and to be reassured by the fact that we have a lot of tools and a lot of knowledge that we didn't have when this pandemic first hit. We have a very high national level of vaccination. That is a really good thing, and that is going to stand us in very good stead as we face Omicron. We have plentiful vaccines and boosters, and that is really important too. It means that as quickly as we are able to get the healthcare professionals out there to vaccinate us, we can add that additional level of protection. We have a lot of rapid tests in the country, and we've ordered a lot more. In the fall economic update, just last Tuesday, I announced an additional 180 million rapid tests that we are acquiring for 1.7 billion. And that was before, this really harsh reality of Omicron had hit. We announced that. We've talked about therapeutics in this press conference. And you know what? We have bought those too, as Jean-Yves has just reminded us. $2 billion to procure 1.5 million courses of treatment, with another 500,000 available if we want to buy them. So these are all really, really important healthcare tools that we have. We have the reality of a high level of vaccination. And I believe that we have public health authorities and provincial and territorial and a federal government that know how to work together and are able to support each other and support Canadians and Canadian communities in doing the right thing when it comes to fighting Omicron. And that is what the federal government is announcing today, that we are putting in further economic support measures to help us all get through these additional public health restrictions that are being put in place. That is an example of collaboration. And it's also an example of foresight and of thinking ahead. The fact that we had these tools already in our toolbox and are able to deploy them. So, look, I would never want to minimize the scale of the challenge we all face. It's a really big challenge. And Dr. Tam has quite rightly highlighted how hard it is, in particular for all of our healthcare workers who are working so hard, are no doubt so tired going into this. And I am grateful to them for the work they've done, and I'm grateful to them in advance. But even as we have our eyes wide open and are realistic about the challenge ahead, I do think it's really, really important also for us collectively to have the confidence and the strength that comes from knowing we can do this. We have the tools to do this. We have the individual character, the collective resilience and intelligence and, community spirit, national spirit that it's going to take to get through this. And I think it is really important for the federal government to say to Canadians that that is the case, because it is.
And I would just very quickly add to that, we heard about panic earlier. This is not panic, this is prudence. Prudence from a health perspective, prudence from an economic perspective. It's also building, I think, public confidence, which has been very strong in Canada, confidence in our institutions and confidence in each other. Unlike, I think, in some other countries, we have shown how close to each other we can be, supporting each other in the context of our federation, using a portfolio of tools, which to be perhaps too not modest enough, is exceptional internationally speaking. So again, prudence, partnership, a portfolio approach to what we do, and I think this is what we need to continue to do as we move, I think, with more success than other countries through this next challenge.
Okay, that concludes today's press conference. Thank you, ministers. Thank you, doctors. Merry Christmas.